Welcome to Slow Medicine Radio. Our host is integrative medicine Dr. Michael Finkelstein. Michael offers medical advice from a holistic paradigm, including both medical and metaphysical philosophies from the full spectrum of human experience. Slow Medicine Radio offers fresh ideas on how to attain a state of wellness that seems distant given the limitations of today's medical paradigm. It introduces you to thought leaders who connect the dots between theory and practice, examining health from a broad perspective with regards to medical diagnoses, conventional and alternative therapies, healthcare policy, and related topics that warrant further thought and discussion. Slow Medicine Radio does not prescribe to take this or do that. Instead, it offers an open-minded, intelligent, and practical approach to living, resulting in greater health individually and collectively. Here is Dr. Michael Finkelstein, the founder of Sunraven, the home of slow medicine in Bedford, New York.
Welcome to Slow Medicine Radio. I'm your host, Dr. Michael Finkelstein, and we're here every Monday at 5 o'clock, 1460 on your AM dial, and worldwide at wvox.com. And the point of this program really is to share with you the conversation that I hear all the time around tables, dinner tables, train stations, airplanes, people talking about their health, talking about questions about their health, and often having some difficulty wading through all the information that's out there about ways to take care of themselves. One of the other things that I'd mention is when I went to medical school, started 34 years ago, 1982, medicine was very different. I would say the 34 years that preceded that, medicine was more predictable, like most of the world. I mean, there was a certain formula in terms of how doctors were practicing and how they were educated to practice. And the classic doctor at that time was maybe not exactly making house calls, but certainly knew about you pretty personally because of all the time that they spent. And the evolution of medicine in this period of time where people spend less and less time with physicians has limited the opportunity for people to speak to their doctors, not only about what the doctor is prescribing, but other questions relating to health and healing. And so this has become somewhat a dilemma. And as a result, it's forced people to find out much of this information on their own. And the question is, who do you go to? Well, I'm pleased to announce that today my guest is Dr. Mehmet Oz, who probably doesn't need much of an introduction for most of you, but suffice it to say that he's one of the region's most well-known and respected cardiothoracic surgeons. He's the host of the Dr. Oz Show, a radio talk show host himself, a journalist and blogger, and author of many books. My personal favorite is Healing from the Heart. I think was his first, almost 20 years ago. And Dr. Oz and I first met, as I alluded, when I started medical school 34 years ago. So did he. We were in the same class. And over this 34 years, we know that there's been a lot of changes in the practice of medicine and healthcare delivery in its entirety. In addition to his career as a physician, then, he is, in my mind, one of the leading voices in a movement which is helping people address their own health and exploring ways in which they can take better care of themselves. And that, I think, we have a lot in common. So I'm particularly encouraged. And so many people are asking questions now, and I recognize the courage it took Dr. Oz to publicly express himself and to share those questions, because he's taken a lot of heat for some of that work. So thus, it's a really special privilege for me to welcome my old friend Dr. Oz to the show, Slow Medicine. Dr. Oz, welcome.
Thank you for having me, and I can probably tell more stories about you than you can of me, but it's been a long time since med school, and I'm honored to call you a friend that entire time.
Yeah, well, it's so interesting. I think when we reconnected after we both took our route back away from, let's say, the most conventional and of the practices, but to explore other ways that people were getting well. And you were doing some work in the operating room with healers of varying forms and really just studying, doing research on what made a difference, which I really was very impressed by, because I also learned in my practice and as the medical director of a hospital that there was something beyond medicine that people were asking about. And for us as physicians, it was really rather important that we sort of start to address those. So I have a couple of questions for you. I know your time is limited. We really appreciate it. But given what has transpired over all this time here, I want to know your thoughts and, of course, your experience on all of this. How do people decipher the information that's out there, some of which we know might be credible, of course, but others is confusing, conflicting, and this is a question I get all the time. So what's your take on that?
Well, a couple ideas that seem to work for me. One is triangulate the information. See if there's two or more credible sources who seem to agree on something. And that provides at least a little extra credibility that there's some legitimacy there. It's always great to have papers published in top medical journals, and you can search for that by looking under the names of some of these journals and seeing if anything's been published, or just type in, academic papers or doctor papers on a topic. And then if there's actually published material, most of the stuff actually is understandable. There's an introduction that to each paper that tells you enough about the background you can figure it out. And worst comes worst, the names of the people who are in those articles, call them, because they certainly are comfortable speaking about it. They wrote a paper on the topic. And those approaches get you closer to the truth. There can still be errors, but then there are system problems. All of us think that's the way the world works, and we might all be wrong, but that's a less likely scenario than one person trying to hype some product at you. And that's probably, if I can give you the last bit of a warning over the web, if something sounds too good to be true, it usually is. If people are selling you things, single solutions, sign here for $20, I'll bring you the Fountain of Youth. You can be pretty sure they'll get your credit card and know how to use it, but you might not get your money's worth.
That's so true. And I think that part of what I have learned to do, we took that oath, first do no harm, is to help people take care of themselves, not necessarily even rely on products, not rely on even other practitioners, but what can you do at home that makes so much sense to me? So it starts maybe with how we feed ourselves and how we deal with stress and how we manage our lives, including our relationships, how we find work that's meaningful so that we're spending time doing something that feels creative and positive. But like I do, that a lot of people do that, and they're still really reaching for the quick fix. They're reaching for something because they're in pain of one form or another, whether it's physical or emotional, and we want to help them. We're sworn also to try to do what we can to help people. So they reach for things that are not in those journals, that are not published. And that's where I think there's this big open space that gets people, I think, a little bit tied up.
Yeah, and it's common, and then, of course, these guys are pretty good at marketing, which is why I want to have at least two different groups saying something is true. Most of the things that are important are free. You control them, and your mom probably told you about them. There's some exceptions, but the most important things are there. On the edges, there's some other ideas that come about that you can take advantage of. But this is where the role of the doctor comes in, because the word doctor means, from the Latin root doctor, a teacher. We're supposed to be able to educate you as the patient. And if we're not doing our job as teachers, or if you don't come to class prepared with questions and an open mind to hear about some ideas, it creates a barrier, a moat, where we can't exchange information well. And then you no longer think of your doctor as someone you can just ask a quick question of, because that's the best way, I think, to use doc. You pop by, you get your one problem, is this mole or lump important? They look at it, they say it's fine. And meanwhile, you've collected 4 or 5 questions, and you can poke answers at them. But I think that's going to change over the next 2 years or so, because the advent of telemedicine and digital connections between patients and doctors and systems like share care that can allow that to happen mean that instead of having to wait 3 months for your appointment, you just send a quick note off. Hey, I just heard this. Well, what do you think? And then there'll be a quick response. And someone in the doctor's office or the physician will respond. You'll have your answer. You'll be connected, and everyone will be happier. The same way, if you had a lawyer or an engineer or an architect for your house or a mechanic for your car, you'd be able to have a quick curbside consult to make sure nothing's wrong. We'll be able to do that digitally with physicians.
Do you expect that, you said in the next 2 years you think a lot of that will change? Obviously, technology is really helping people in that way, which is that and I have spoken to Jeff Arnold at ShareCare about what you and he are working on to develop. I actually saw the video that you did where you were inside a lung with a woman with asthma, which was quite fascinating. People, and of course your earliest show that I recall, where you were taking out the pathological specimens with your now famous purple gloves and showing people what it looks like inside their body. It's so important for people to really understand, see, perhaps, visualize what's really going on so that they can connect the dots between information and ideas, some of which obviously is probably right there in their own house, already free, to really apply and make the quality of life and the quantity of life improve.
Yeah, so that video you mentioned was the first of its kind, because it was a 3D and 360-degree video, which means and virtual reality. So just to be clear, that means that from now on, as we start to tell these stories, we won't be limited to the traditional way we look at a TV screen. In these videos, like it's a video game, you actually enter into it. You put your Oculus Rift glasses on or use a Google Box, and you're living inside the body. And the story you tell has to be different accordingly. You can't just have some linear person walking along the street. You can now have, in this case, for example, a woman who's having a panic attack, an asthma attack, and as her world begins to close in on her, it goes black and white. You can put the virtual reality experience in a wall. You can put it in a tree. You can put it inside of her. And with your glasses on, you can literally, in the video, as it's moving, have different experiences. You can look behind her. You can look at her. You can look what she's looking at. You can go inside of her. So the ability to tell stories that are much more able to deal with that complexity and flexibility is going to change everything.
Yeah, when I saw that, I thought the intelligence went beyond just the words or the information. Some people learn differently. A lot of people are visual learners. And the words that we use, even if we simplify them so that they're bite-sized pieces and understandable for most people, still, it's complex thinking. There's a lot of details. There's many layers. But if you can see an image, I think people learn in a different way and get motivated, perhaps, to make those changes because they can see sometimes how things get out of hand if they don't really get to it early enough. In fact, what I think you shared on there was how she could take the deep breath, how she can relax, how she can get out of the sympathetic nervous system's fight or flight response that she was in into the parasympathetic, which I call the slow medicine of it all. And so I think that sort of thing, and I give you credit for that and all your work, is really remarkable. And I do appreciate your time today to speak with us. Any last question I have, if you have a question, is what would you like to see change in medicine? Beyond what you anticipate will happen, what would you really like to see change, whether it's the way physicians respond to questions, whether it's the medical education system, whether it's how people are educated about taking care of themselves?
The biggest opportunity, I think, we are now in a time in our history where it's possible, is for preventive approaches to take dominance. We're in a healthcare system that is really hard to imagine making affordable unless we start to reduce the risk factors for disease. So much of illness is caused by either things to do to ourselves or that society does to us, whether there's toxins in the environment, ranging from water to air to the food you eat to the individual decisions you make with food choices we made it easy to make the wrong ones, but you're out there on Halloween night chomping down a couple thousand calories of candy only to have the same thing repeat tomorrow night because you got leftover candy. And if we can find a way of instilling in people the confidence that they can control their destiny and be the world expert on their body, that would be the biggest shift. And I think it's happening now because we have the ability to customize and personalize to you. I can look right at a person and say, you're the kind of person who's going to get X, Y, and Z problems. And if you want to lose weight, do diet A, not diet B, C, or D, or E. Just do diet A, but here are the little modifications on it. If you want to avoid cancer, do this thing. If you want to make sure your blood pressure is in the right spot, which that's number one ager of all, do this thing. And then I can tell you what important things to focus on and what are the areas where, if you have 2 beers versus 1, it probably won't make that much of a difference. So you can relax about things that don't matter.
Mm-hmm. Well, that's the way to do it, is to really get through life. And also not forget about the quality. I find when people get too neurotic about these things, they wind up feeling deprived, and then they're not even feeling good. So maybe they live 2 years longer, but they have this deprivation state and a little sadness and a little isolation or something else. I don't think we need to throw out the baby with the bathwater. So,
well, I was doing interviews this week, and people kept saying, what do you do for Halloween? What do you hand out? And I said, I give them itty-bitty little balls of yogurt. Of course, everyone was horrified, and that's not what I do. I give them little candy. And the serious response is that if you're having a good time with your friends, that's healthier than any meal you're making.
Exactly.
You just got to build a friendship group that naturally resonates to healthier options. And they're not supposed to be boring or tedious. They're supposed to be fun and pleasurable because it feels good while you're doing it and after you're doing it, and that's doable.
Yeah. I often say, what's on your plate is important, but what's on your mind at the time that you eat what's on your plate is equally important. And so this is how we just connect the dots and we combine common sense and wisdom and knowledge and information and help people really take better care of themselves. And then we're all in a happier place, and maybe some of our more global issues will start also moving in the right direction. I certainly pray for that.
I think we all do.
Yeah. So, well, Dr. Oz, thank you so much for joining us today. I hope you have a great week ahead, and I look forward to seeing you soon.
Take care. Bye, Michael.
Bye-bye. Well, so that's those are some important words, I think, from somebody who is a professional wordsmith about the subject of health and healing. And, it's maybe a good time to take a moment to pause and take a break. Maybe think about what you just heard. Think about perhaps what's in your own house right now that could support your own health, what kind of simple changes you can make. I like the idea of identifying a friend group where the healthy changes will be easier to make because you're going to do that together. That's a thought. Perhaps something good to do at this time. It's sort of a holiday, but as we enter the holiday season in the next 2 months. Anyway, we'll take a break and we'll be back for Slow Medicine Radio. Stay with us.
You're listening to Slow Medicine Radio. You can find out more about the show and the work of Dr. Michael Finkelstein by visiting his website, slowmedicinedoctor.com. Slow Medicine Radio is sponsored by the Slow Medicine Foundation, dedicated to providing community-centered, experiential, and reflective learning for individuals, families, and groups, offering educational programs, events, and resources, as well as insightful health evaluations with customized medical guidance. Dr. Finkelstein works with his wife, Robin Queen Finkelstein, at their farm, Sunraven, in Bedford, New York. And they invite you to visit and take advantage of this unique resource, including men's and women's groups and couples programs. If you think about it, much of what we experience when we don't feel well is a result of that fast world and how it affects us. Therefore, if fast is the disease, then slow is the medicine. Visit Sunraven, the home of slow medicine in Bedford, New York. Go to slowmedicinedoctor.com or call 914-218-3113. And thank you for tuning in Mondays at 5 p.m. right here on 1460 WVOX.
Welcome back to Slow Medicine Radio. I realized before the break that I didn't give you the phone number to call in if you'd like, and that's 914-636-0110. Again, it's 914-636-0110. We have about 10 minutes left in today's show, so pick up the phone if you have any thoughts or reflections on what you heard in my conversation with Dr. Oz. I can tell you a couple of things that I was thinking about while we're talking about it, and this reflects back a little bit on the show from last week when we talked about diet and supplements. And the caller that week asked a question about vitamin D3, and there are other supplements, multivitamins, and other things that we had discussed. But the emphasis, I think, in that conversation, and the one reflecting on today's, is what you put in your body. From the most basic thing, the food that you put in your body is going to really make a big difference. It may be the single most important measure that you can do. Now, quickly, I want to add, that's maybe the most difficult thing to change. People, for the most part, know that what they put in their body will make a difference, that if they eat too much fatty food, processed foods, foods with artificial ingredients, foods that are toxic because of how they're grown and what they're sprayed with, most people are clearly these days aware that less of those are better, and more whole foods, more vegetables, more local foods, more seasonal foods. That's what we talked about last week. Yet, it's one of the most difficult things to really change. You look at a day like today, Halloween, where, from the time we were children, raised, at least in this country, we're used to getting bags of candy on this particular day, and maybe our mother portions out how much we can have at any given time, but the sweet stuff is coming. And this is a time of year with the holidays in just a few weeks where food is really the focal point. And a lot of foods are really the tasty ones, of course, those with maybe more fat and sugar, and special foods. Now, I like the idea of what Dr. Oz said, which is, if you're sitting around with people you love and you're having a great time, then really nothing could be better for your health than that. But if you can couple that and take the energy of all the positive feelings and the nourishment in those relationships, and maybe speak to those same people and say, look, but we're having a great time. Can we have a great time and help each other move in the direction of some better lifestyle choices? Maybe in this case, is the example I gave you with regard to the food that we eat when we go out together. Maybe if you do that just 1 out of 5 times, you're still helping yourself move in the right direction. And I think one of the problems with change is that people think it sort of has to be all or none. And my suggestion here is just do a little bit. Take one step. Do it once. Don't think about doing it every week. Certainly don't think about doing it every day for now. Just see if one day you can eat no processed foods. nothing that comes in a bag or a box. Maybe one day that you can eat no animal products, no dairy, no meat or fish even, just for the sake of eating local vegetables. Again, no processed food. See if one day you can do that. Or instead of having 3 meals a day with that ingredient, make it just one meal that day that you have an animal product. See if you can do something that you know is going to improve what you're putting in your body. And start there. Then maybe not think about doing that again for some period of time, whether it's another week or another month. But then pick it up again. Figure out whatever frequency it is where you can manage that, and that's where you begin. Eventually, you can move in the right direction. You can add a second day, or you can add a second meal, or you could make it more regular. There's really nowhere to go fast. Hopefully, we all live long lives, and so have plenty of time. But I wouldn't take the time for granted, nor would I assume that it doesn't have impact, because today's meal could actually make a difference for you right now. Just think of indigestion. You could eat a meal and certainly produce indigestion, or you can avoid that. You can eat a meal and be constipated tomorrow, or you can avoid that. You could eat a food and have a headache tonight or tomorrow, and you can avoid that. So there are immediate symptoms that you can actually avoid, and every day that you avoid symptoms like that, you have to understand that your body on a cellular level, in every way you can look at it, from inside the cells, metabolism, in terms of how your blood flows, your heart is pumping, the organs like liver and kidneys function, how your brain is, these are all going to improve. And imagine if you can just build from here to some place where maybe a year from now you look back and say, I'm 50% of the way. That would be an incredible achievement. And that's my hope for you. And that's the work that we do at Sunraven, by the way, is, where I work in Bedford on a small farm. It's really to share with the people who see me an environment which not only models behaviors like that. And we're careful, by the way, we're not perfect. So we allow ourselves a number of things that look normal so that we're not really just putting ourselves out there as being almost unachievable. But we want to bring people to an environment that feels so good, where the foods that maybe you're not as familiar with, like the vegetables, are prepared in such a way that they're really tempting, and that you're around other people, this group of people there's resonance in supporting your pursuit of health is easier, that there's fun associated with it, there's beauty associated with it, there's other nice people, and all of this comes together to produce what I've imaged as the slow medicine wheel of health, which are 7 spokes, which includes the body, of course, and the mind, and our relationships, and nature, and what we do in our lives. So you can join us actually at Sunraven for some upcoming events, particularly in December around the holidays. On December 18th, we're going to have another open house and a slow medicine cafe. We're going to serve some farm fresh food, have a great environment, some music, have our friends there who do other forms of work that are interesting, and maybe sell some simple products like honey and teas from the Sunraven gardens for the holidays. So that's December 18th, and you can find that on the website, slowmedicine.org. And I'm going to be around in the Westchester area giving a couple of talks that I want to share with you. On December 5th, Quest Yoga in Mount Kisco. On December 11th, Radiate Yoga in Pelham. And on December 20th at Gilda's Club in White Plains. And all that information is on the website for Slow Medicine. We have a couple of minutes. If you want to call in, you can shoot a question, 914-636-0110. Otherwise, let me take you to another thought. This time on the subject of supplements, which we talked about last week. The producer here, Don, asked me a question right after the show, and it dawned on me that I didn't really address when you take a supplement for a symptom. I was talking more generally about supplements like multivitamins or magnesium or vitamin D3 for general use for the average person. But, there are people who have symptoms like stomach problems, digestive problems, headaches, pain, inflammation. And there are many supplements out there that are purportedly useful for those things. Again, I want to reiterate that diet, particularly an anti-inflammatory diet, maybe we'll talk about that next week if you'd like, but is the first way to go still. But occasionally when you have a symptom, that's not an unreasonable time to try a supplement, one that maybe you can research by first maybe speaking to your doctor or other healthcare provider or going on the internet, as Dr. Oz said, being careful, trying to triangulate maybe a couple of sources so that you can validate what you're finding. And again, if it's too good to be true, it probably isn't. But maybe there's a supplement out there that might help you with a symptom. And when you have a symptom, the easy thing about that is if the symptom goes away shortly after you begin a supplement, then you have some clear evidence, at least your own, that it may be contributing to you feeling better. And so that's when I feel like a supplement for a specific symptom can be very useful. The caveat there is it's not something necessarily you want to continue indefinitely. So maybe after a few weeks or a month, you stop using the supplement and seeing if that symptom recurs or not. Because I hate to see when people walk into my office with bags and bags of supplements, some of which they started decades ago, and they just never stop because they have assumed that they might still need them. Not always the case. Anyway, those are my thoughts for today. Again, I want to thank Dr. Oz for joining me as my guest. I want to thank you for listening. We'll be here next week on Slow Medicine Radio. Until then, please take care